Dr. Jones and fellow classmates. My name is Deidre Burgess, and today in my audience I have Mr. Berry, Miss Carol, Miss Brittany, Miss Kiana, and Mr. Gus himself. Today I'll be demonstrating some aftercare treatments for bee stings. First question, anybody have ever encountered a bee sting before?
Sure.
What was your situation like?
I was at work and like I said, came upon some yellow jack
Mm-hmm.
coming out of the ground and stuff, and I got stung like 5 times. And what I did, I got a cigarette from a coworker, and I took it and chewed it up, and I put it on the bee stings, and it sucks the poison out.
Oh, okay. Miss Carol?
Mine was on my porch. I went to kill the bee and then realized there was a nest on the porch, and I had actually got like 15 bees staying on my arm. Had to go to the emergency room and they had to pluck each and every one of them out, but found out that I was not allergic to bee sting.
Okay, well, thank you for sharing that with us. For those of you that have not been stung, it's more of a agonizing pain. Swelling occurs. Sometimes you have allergic reactions, depends on, who the person is. But my purpose of giving this demonstration is to basically show you some home remedies that you can use. Because you may not be close to a Patient First or a Riverside or an Immaculate. So you may be wondering why I'm so interested in treatments for bee stings. Well, I personally am terrified of bees, especially being stung. And just to know the options that I do have, just in case I can't get to a Patient First, is really important to me. So during my demonstration, I'm going to give you a little bit of background on why and how bee stings, some home remedies that you can use, and what can happen if you don't treat a bee sting. So, anybody know why do bee stings? No?
No.
Or how?
No.
Okay. Well, stinging insects in general have two reasons why they sting: defense and predation. Primarily, bees use their stinger for defense. 9 times out of 10, if they're away from their hives, they're not really thinking about stinging, people or pedestrians. But if they feel aggravated or intimidated, then they will do so. By smell, color, that attracts them as well. Honeybees and bumblebees are different. Honeybees have a barbed stinger, and bumblebees have a soft stinger. So once a honeybee stings you, their stinger is detached from their abdomen, so they can only sting you 1 time. But when a bumblebee stings you, because it's so soft, it can sting you multiple times. So maybe you want to keep that in mind, maybe. So some care remedies that you can use, or some home care remedies that you can use, is tweezers. Of course, tweezers, primarily tweezers, because once they sting you, they're still pumping venom into your bloodstream. So you want to use a stinger to remove you want to use a tweezer to remove the stinger. Then after that, you want to use soap and water to help prevent from any infection later down the line. Then you can also use some honey, which can reduce the pain. You have lavender oil, which you use a drop of that can neutralize the venom. You can also use ice packs for the swelling. Now, if that doesn't help, you can also use like ibuprofen over the counter for pain, or you can use an antihistamine to reduce the swelling. Another thing that I want to talk about too, which I think is really important for pregnant women, being stung, that can cause a hormone, like I said, histamine, which causes swelling, and it can cause the wife or the pregnant woman to have contractions and may have a miscarriage. So that's really important to know. Some things that can happen if you don't treat a bee sting, trouble breathing, chest pains, dizziness, nausea, confusion, low blood pressure. There's 3 types of toxic in the venom. You have neurotoxic, which is a perilous for the local nervous system. You have hemorrhage, which increases permeability for the blood capillaries. And you have hemolytic, which is a destruction for red blood cells. So this presentation was primarily to, like I said, demonstrate some home remedies that you can use to take care of these things. Anybody have any questions? No?
No.
Alright. Well, thank you for your time, and I greatly appreciate it.